Hi, this is Dr. Anjana. Welcome to Gynec 360. We are going to discuss the miscarriage series, the first video being definition, risk factors and etiology of miscarriage. Let's go into the video. Let's start with what is a miscarriage. The loss of pregnancy before the fetus reaches its viability, that is, all pregnancy losses from time of conception until 20 weeks of gestation is called as miscarriage. RCOG consider it up to 24 weeks of gestation. Miscarriage is subdivided as early pregnancy loss, that is before 13 completed weeks, and second trimester pregnancy loss, that is 13 to 24 weeks of gestation. Miscarriages occurs in 15% of confirmed pregnancies. If unrecognized or subclinical pregnancies are taken into account, the incidence of miscarriage is actually double, that is around 30%. So let's discuss the risk factors for miscarriage. Imagine a 40-year-old obese doctor, Jennifer, walking into your clinic as a patient. She is an anesthetist working in nearby a nuclear power plant. She is having previous history of an abortion, and she is also diabetic and hypothyroid. Her work stress is too high, and she has caffeine or smokes to relieve her stress. This sums up the risk factors for miscarriage. So the first main risk factor is advanced maternal age. Older the woman, older is the oocyte, resulting in chromosomal abnormalities, which tends to miscarry again. So the incidence of miscarriage for 30 to 35-year-old women is our miscarriage number 15%. For the next 5 years, it's 25%. For 40 to 45 years, it's 50%, and more than 45 years, it's around 80 to 90%. The second risk factor is previous history of abortion, as there is increased probability for the underlying cause of abortion to repeat itself. So if a woman is walking to your clinic and asking this number to you, doctor, last time I ended up in an abortion, what is the chance that this time also the abortion can happen? So you need to know this number. So the risk of miscarriage in previous one abortion is again 15%. 15 is the number in miscarriage, and for 2 consecutive miscarriages it is double, that is 30%, and for 3 consecutive miscarriages it's around 35%. Other risk factors are previous history of thyroid disorders or type 1 or type 2 diabetes mellitus. This doubles the risk of miscarriage. Also, obesity, BMI of more than 30 kg per meter square, or underweight also increases the chance of abortions. Caffeine consumption, smoking, alcohol, consumption of recreational drugs, occupational exposure like radiation, and stress also increases the chance of abortion. So let's discuss the etiology of miscarriage. Sporadic miscarriages occurs by chance, common problem being in the fetus. Chromosomal defects are the main common cause which accounts for 50% of the miscarriage. Especially in miscarriages 6 to 10 weeks of gestation, this number is high as 70%, and between 10 to 20 weeks this number is around 30%. The most common chromosomal abnormalities are autosomal trisomies like Down syndrome, followed by triploidies and monosomy X. Other causes are structural aberrations and mosaic patterns also. This all increases with increase in maternal age. The second cause of the sporadic miscarriages are congenital fetal anomalies. Mostly these fetal anomalies can be because of the chromosomal defects as discussed earlier, or 20% can be in fetus with normal karyotyping. Other causes are torch infections, toxoplasma, rubella, cytomegalovirus, herpes simplex, or parvovirus or syphilis in mother. It can also be because of genital tract infections. These infections can cause sporadic miscarriage but not recurrent pregnancy loss. Multiple pregnancies, prenatal invasive procedures like CVS or amniocentesis also can cause miscarriage. So let's see the causes of recurrent pregnancy loss. Antiphospholipid antibody syndrome. It accounts for 15% of women with recurrent pregnancy loss. It's an autoimmune disorder that causes slow progressive thrombosis and infarction in the placenta. The second cause is uterine abnormalities like uterine malformations, submucosal fibroids, septum, or intrauterine adhesions. This generally interferes with implantation or uterine distension in second trimester. Parental balance translocation, which usually does not affect the parents but can cause unbalanced translocations in fetus, is also one of the causes of recurrent pregnancy loss. Endocrine disorders like uncontrolled diabetes, thyroid, PCOD, or luteal insufficiency also causes recurrent pregnancy miscarriages. One of the most important causes of recurrent pregnancy loss in second trimester is cervical insufficiency. It is inability of the cervix to retain pregnancy. It causes painless miscarriage in second trimester. It can be due to congenital weakness of cervix or acquired structural defects due to surgical procedures like forceful dilatation of cervix or cervical tear or cervical amputation or conization, LEEP and trachelectomy procedures. Inherited thrombophilia like protein C or protein S or antithrombin 3 deficiencies or prothrombin gene mutation causes venous thromboembolism, which in turn causes fetal loss or preeclampsia or FGR or abruption. So that's about risk factors and etiology of miscarriage. Let's discuss about investigations and management of miscarriage in the upcoming videos. Thank you.